I'm actually a dental monitoring user right now, and so for me, dental monitoring means that I don't have to go to the orthodontist as frequently. It means that I feel like I'm in closer touch with the orthodontist than I would if I was just seeing my orthodontist every 12 weeks or something like that. So I feel like I scan once a week, and I feel like I see my orthodontist once a week. I travel every week somewhere, and so I throw my scanner in my suitcase, and when it's my day to scan, I do a scan. I get a kind of a red light, green light to go to my next aligner set or not. And so for me, it's super convenient. I think I will go through my treatment course with 5 visits to my orthodontist, and I don't feel like I'm getting anything less. I'm actually thrilled that I don't have to go and things like that. And I think in today's economy, for people right now, when money's a little bit tighter, when gas is a little bit more expensive, just to carve out 2 or 3 visits, maybe 4 or 5 visits even in a case, it's actually really meaningful to the consumer. I think it's a differentiator that helps you get to yes more. So I think besides being a better diagnostic tool, it's also really a differentiator in practice life right now. First thing you see is some relief in your schedule, and that's helpful because everybody's fairly stressed out right now. The second thing you see is feedback from the consumer that keeps patient treatment on track in a much tighter mode. So if something goes awry in treatment and I don't have dental monitoring, I have to wait till the next appointment to figure it out. Then I spend that appointment, instead of moving forward, kind of fixing what was broken for how long we don't know, and then I can get back on track. So it tends to delay treatment. And as an orthodontic practitioner, what I'm seeing doctors experience is better information faster, ability to maneuver quicker. Life is messy, things happen, and this is just a tool for a lot of things, but one is it keeps the patient's treatment on track. So when you tell me my treatment's going to be 18 to 24 months with dental monitoring, you can hit that number. And when I value practices and I see a bunch of patients that are over their estimated length of treatment time, maybe they were non-compliant, maybe they just didn't wear their rubber bands, but maybe it was because, if I could have done things faster, I could have gotten them out on time. That ends up with a happier patient. So, it's a really holistic approach, I think, for the practice. It affects the team, it affects the doctor, it affects the patient, all in a positive way. In my view, that's a win-win-win.